The mysterious life-destroying disease breaking out all over the country that's causing victims to lose control of their limbs, suffer violent seizures and chronic fatigue and pain. The federal government is adamant you can't catch it in Australia, but thousands of Aussies say they did and struggle to receive proper care. Many are told the symptoms are all in their head, and some have been turned away from hospitals, accused of being a drain on resources. More and more desperately ill patients are now spending their savings on a radical treatment overseas, which promises them a cure. Rani Sadler reports.
I don't know one genuine case that has been acquired in Australia.
The top neurologist in Sydney said it's all in your head, go away.
Come on, Maddie, open your eyes. Open your eyes.
The most difficult and most complex illnesses I've ever seen. It's not as simple as it's just in their head. That's bad medicine.
Bad medicine to misdiagnose a patient and treat them for something they haven't got, quite frankly.
It felt like I was watching her die.
They're being treated for a disease they don't have, and most of them aren't getting any better.
How many people are still living with this and just think that it's their fault?
Come on, Mum. Breathe, breathe.
Can you describe what that was like, having a seizure?
The
That first one?
first one, I was terrified. I had no idea why it was happening, what was happening.
Big breaths. It was hard to watch her on the ground having a seizure and not be able to help her. It was hard to leave her to go to work every day just to support us.
This is love, it last, heaven knows.
Maddie and Dean Bridgman tied the knot in February 2013 after dating for 7 years. The couple's wedding day was special, everything they'd wished for.
I promise that we will be together forever. I love you more than words can describe.
In the months before the ceremony, Maddie, a 25-year-old student nurse, had begun having seizures doctors couldn't explain. She made it through her big day, determined to dance at her own wedding.
Our wedding was amazing. It really was. Lots of great people, family. Our honeymoon was amazing.
Maddie's relapse happened in Vietnam, and Dean nursed her through more seizures until he could bring her home. A few weeks after their return, his vibrant young wife could barely stand or walk.
Matt! Matt!
Maddie, come back. Come back.
Matt! Matt! I was having 11 seizures a day, and some of them would last about 10 minutes. I couldn't get to the bathroom without... I couldn't walk to the bathroom without falling over. I had to stop everything. I had to stop uni, I had to stop going to work, I couldn't socialise.
Maddie's mysterious illness was destroying her life. She saw 3 GPs and was admitted to 3 different hospitals.
Nobody could give us an answer as to what it was or why it was happening. So yeah, it was pretty terrifying.
Come on, breathe. Breathe.
She saw a psychiatrist, a psychologist and a neurologist. She was constantly told this was psychological. It was all in her head.
It's hard to have a nurse yell at your wife and say, "You're making this up, stop shaking," when you know that there's something wrong. You know that it's not all in her head.
Doesn't look like it's in your head.
No, I honestly don't know. I don't know how you could put that on. Personally, I don't know how you could put this on. Oh, God. On purpose. Why would you want to do that?
Come on, Maddie.
Maddie was tested for Lyme disease during her second stay in hospital. But when the result came back negative, a nurse told her to go home and stop wasting their time.
You feel like you're worthless because you're the one that's causing all these problems for yourself. Like, you're making this up. You're being a drain on hospitals if you go in there and you take up A&E time. And if I was really sick, I wouldn't go to the hospital because they would just send me away.
I think it's very easy to dismiss someone as mad when really you've got to do the hard yards and say they're sick.
Dr Dr Schloeffel is one of the few doctors in the country who believes not only that thousands of Australians have Lyme disease, but that many of them caught it here. When he treated Maddie, he was certain she had it, and in May last year, he sent her blood to a specialist lab in the US. It tested positive for Lyme. What is Lyme disease?
Well, Lyme disease really is a collection of infections, not just one infection. So you'll probably get originally a tick bite, but it can be anything that bites. So we think in Australia it could be march flies and midges as well, but definitely tick bites.
Lyme disease is caused by a bacteria called Borrelia. If a tick infected with the bacteria bites you, it transfers the infection into your bloodstream.
It basically vomits this stuff out into your bloodstream and then sucks out your blood to fill itself, falls off and breeds. So it's part of its breeding cycle.
The Borrelia bacteria then launches multiple attacks on different parts of your body. There can be as many as 150 symptoms, ranging from headaches and muscle pain to violent seizures like Maddie's.
Your body starts to break down, whether it's in your brain or your joints or your muscles or your gut, and that leads to a very broad range of symptoms of anything you could possibly imagine could be the diagnosis.
Thousands of Australians are suffering the symptoms of Lyme disease, but few have found successful treatment here for one simple reason. Most Australian doctors and health bureaucrats don't believe there is Lyme disease in Australia. How many Australians do we believe have Lyme disease?
Well, I've heard of many, many people who believe they've got Lyme disease, but at this point in time, I don't know one genuine case that has been acquired in Australia.
Microbiologist Dr Stephen Graves was a member of the federal government's expert panel, which recently reported not one tick in Australia has tested positive for Lyme disease.
We do have people in Australia who catch Lyme disease while they're overseas in Lyme disease endemic countries, but we haven't had one definite case that everyone is comfortable with that was acquired in Australia.
Maddie has travelled overseas, but she can only recall ever being bitten by ticks near her home in Sydney.
You just got ticks all the time. It wasn't a big thing at all. It was just, you know, your mum tick-checked you and pulled them out, like with fingers or tweezers, you'd still have some left in there and you wouldn't even think about it. Because it does stay dormant for so long, I could have got it 2 months before my symptoms, or I could have had them since I was 6 years old.
Lyme disease is named after an outbreak near the small Connecticut town of Lyme in 1975. Some locals claim it was created in a secret research laboratory on a nearby island operated by the US government, which conducted biological warfare experiments during the Cold War. These accusations are vigorously denied. What is certain is that in the 3 decades since, there have been outbreaks of Lyme disease all over the world.
Back in 2012, I got a bite on my arm, which I thought was a spider bite. at first, but I ended up getting like a huge rash here. And basically from there, I started to become really tired and, you know, I couldn't walk properly.
Larissa Castle grew up on Sydney's northern beaches, not far from Maddie, and had an active life.
I'm a physiotherapist, so I was working full-time. Surfboat rowing, that was a massive part of my life.
She loved the outdoors and keeping fit. A picture of health, until that bite 2 years ago.
First, they thought I had anemia to account for the tiredness, and then a doctor diagnosed me with asthma to account for my breathing problems that had developed. And as the disease progressed, I thought I had some neurological problems happening, like some depression and anxiety. And then they thought I had appendicitis. So I had a surgery for that to investigate.
Larissa didn't have appendicitis. For at least a year, her illness was a mystery no doctor or specialist could properly diagnose. She quit work, gave up her sports, and stopped going out.
I just thought, you know, is today the day I'm going to die, or will it be tomorrow? Like, I had no idea. So, yeah.
And you kind of didn't mind the idea of dying?
Sorry.
That's all right.
Oh, it's just really hard to live with when you can't do anything.
My view is that many doctors go, oh, this is too complicated, too many symptoms, they can't really be sick, you can't have all these symptoms.
A lot of the neurological symptoms like progressed, so I started getting hallucinations and nightmares from those, and they were pretty horrific. To think your brain could actually think some of those things was also really frightening and disheartening.
How damaging is it to patients who are suffering a large number of symptoms to then be told that these symptoms are in their head?
Extremely damaging. I actually hold the medical profession responsible for lots of damage to these patients.
There's been a lot of times that I've thought, I just want to go to sleep and not wake up.
Kim Pearson-Jones and her husband Martin run a tourism business in Broome. When Kim got sick in 2007, a specialist treated her for chronic fatigue syndrome, but her health deteriorated. Kim's doctor suspected Lyme disease and sent her blood to labs in Germany and America. Both times, the results were positive for Lyme.
On our property at home, we've got kangaroos. The kangaroos have got ticks. You go for a walk. Do you get it, one bites you and you brush it off, or... You know, we don't know, but again, there's no research.
Bureaucrats say there is no Lyme disease in Australia and everything's in your head. What do you say to that?
I would say they've got their head in the clouds or something. I don't know. I can't understand it.
Hundreds, thousands of Australians have tested positive for Lyme disease overseas. Are you saying all of those test results are wrong?
They probably are all wrong. There are laboratories who I do know charge a very large amount of money for these tests. And basically, I think their philosophy is just use pay us your money, we'll give you the result you want. Run a test on a patient's serum and they get paid.
So they're looking to make money, possibly.
Well, you could say that, yes. Well, they're a business, let's put it that way.
In Australia, even if you test positive for Lyme disease, Medicare only covers the first 2 weeks of antibiotic treatment. More and more Australians are heading overseas to undergo a radical new treatment that appears to be having remarkable results. Organising my Rosfin IV for the week. I give this to myself 5 days a week through the PIC line that I have. Student nurse Maddie Bridgman has spent the past 8 months at home in Sydney treating her Lyme disease with strong antibiotics. With no improvement and her seizures worsening, she caught a plane with her dad and her husband Dean to Germany, where breakthrough treatments are being offered.
Oh, he is coming with us.
The joy doesn't last long. During the flight, Maddie has another frightening seizure.
I think we were full of adrenaline And I think that we just wanted to be there, and we had a lot of hope, a lot of faith that it was going to work.
Unable to find answers back home, hundreds of Australians are travelling here to Germany, where doctors are experimenting with an old-fashioned but controversial treatment that they claim is the only guaranteed cure for Lyme disease. Maddie's destination is the St George Clinic in the town of Bad Aibling in the Bavarian Alps. Larissa is also flying in, also in a wheelchair.
I was pretty shaky. I was really frail and, yeah, very weak.
Hello, Larissa.
Hello, doctor.
How are you this morning?
I'm feeling okay.
Dr Friedrich Dowles runs the clinic. He made the chance discovery while treating cancer patients that heating a patient's body can kill the Lyme disease bacteria. The procedure, hypothermia, gives them an artificial fever.
Most physicians in medicine don't know anything about hypothermia. The only God-given treatment is the fever, and therefore hypothermia, we should use hypothermia because it's a God-given form of treatment.
This is now your blood pressure for you.
Okay.
It's really controlled every 15 minutes.
Okay, thank you.
Larissa is scheduled to have 3 hypothermia sessions. Over 6 hours, her body temperature is heated to 41.7 degrees. There have been no scientific studies that prove the treatment works.
What we know about Lyme disease and some of these co-infections, they are highly susceptible to temperature. So if you superheat the body, you get a massive die-off of these organisms. So the whole body is almost like sterilised.
It sounds dangerous.
No, it is not dangerous. You know, we have more than 18,000 whole-body hypothermias and no problems. I knock on wood, because this is very important to say, and in our hands, it's a completely undangerous or unrisky treatment.
So how did you feel when you woke up?
Oh, I felt pretty bad, like I'd been knocked over by a truck or something. Like I was just really tired and, yeah, I don't remember much of it.
Maddie was also exhausted after her first treatment, as was her husband Dean, who had tested positive to Lyme disease. Some doctors believe the bacteria can be sexually transmitted.
I still feel pretty sick. I've still got lots of nausea. But apart from that, feeling pretty all right.
Relax the body, all the muscles, the joints, the nerves relax.
The clinic offers more than just hypothermia. To rebuild Larissa's immune system, there's Reiki, acupuncture, foot spa detoxes, magnetic therapy, ozone therapy, laser therapy, and intravenous antibiotics. And it all comes at a price. Larissa will spend $30,000 on her trip and treatment. Dean and Maddie, $55,000.
So I just have to see how we go.
About 90 minutes drive away in the town of Augsburg, there are more desperate Australians looking for a cure and willing to pay anything for it.
I've spent nearly $50,000 here on my treatment.
They've come for intensive doses of antibiotics and vitamins. Among them is Kim Pearson-Jones from Broome. How much do you think it'll cost all up?
Oh, about $35,000 probably.
$35,000.
Yeah.
Kim, who now needs a walking stick, will live here for the next 3 months.
How important is it to you that this treatment works?
Extremely. I think it's the last hope, really. I don't know where you would go from here.
Kim, you're really loving life now.
I am. I'm very lucky. I can get to do what I want to do, walk down the beach. It's fantastic. Got my life back.
What are some of the things you can do physically that you couldn't do before?
Walk. No.
That's a pretty big one.
Yeah. I've been swimming and I can walk properly now.
In Sydney, physiotherapist Larissa, who struggled to get out of bed before hypothermia treatment, is feeling much better.
So I've been doing quite a bit actually, like working on my physical fitness and riding my bike down in Manly and going for walks, and I went skiing as well.
Out of 10, how much of a difference has your treatment in Germany made to your life?
Oh, 1,000.
That's a lot. Cheers to 1,000. We interviewed several patients who were suffering very serious symptoms. After going to Germany and being treated, they're much better. What do you think is the cause of that?
Well, that's very pleasing, and I don't know why they're getting better, but it's good that they are getting better. But it doesn't mean that it's Lyme disease that's being treated. They've got some other condition X, shall we say, that is responding to the treatment that they're getting in Germany.
Microbiologist Dr Stephen Graves is sceptical. While many Australians like Larissa, Maddie and Kim show significant improvement following treatment in Germany, others report relapses.
I'm not saying they're not sick. They clearly are sick. Some of them are very, very sick. All I'm saying is we don't think they've got Lyme disease.
They will never understand how hard it is to be sick and to have nobody listen or pick up on it or say, I believe you. It's hard to have a nurse yell at your wife and say, you're making this up, stop shaking, when you know that there's something wrong. You know that it's not all in her head.
Before her trip to Germany, Maddie Bridgman struggled to walk. Today, she's on the road to recovery. She's going back to university to get her nursing degree and is exercising again.
Just giving me my independence back, that's what it's done for me, and that's what I am more grateful for than anything, getting my independence back and getting to be able to do all those things. And it's happened so much quicker than what we thought, so it's been incredible. Almost, yeah, a miracle. A miracle.
Rani Sadler reporting, and we have more information about Lyme disease on our website.